on this very important webinar this evening. Hopefully that all of the questions and concerns that's raised could be answered. I would like to thank Ms. Parker and her team, H&H, and everyone on this call. And most of all, thank you, Dr. Jordan, for making this call happen. Thank you, retirees, for the impact you have left behind. Thank you for all of your diligence and your faith and trust in health and hospitals. So I'm going to turn it over. Won't be long. Thank you for coming again.
Thanks, Judith. Kim, before you start, I'll allow you to introduce yourself to the group and we'll get started. We have Tamara Lake from OLR and Matt Campisi as well on the line.
Okay, wonderful.
Hi, how are you? I think Matt was trying to reconnect.
Go on, Tamara.
He's there. Hi.
Okay, go on.
Yeah, no, Matt, he got back in. Okay, just checking. Hi, everyone.
All right, Kim.
Okay, wonderful. Celia, thank you very much for helping coordinate this meeting. I appreciate this opportunity, and I'm hoping that by the end of this presentation, everyone's going to have a little level of comfort that many of their questions are going to be able to be addressed during the course of the presentation. My name is Kim Parker, and I am the account executive from Empire that will be responsible for managing the City of New York Medicare Advantage Plus program for the city. So I will be the direct contact the city and the unions have relative to this program. I have my colleague with me on the line, Marlon Pavone, who's the account manager who will be managing this with me. So Marlon's out there somewhere in the participant arena. So as I said at the very beginning, my goal is to be able to address many of the questions that have come up from retirees in regards to the new program and how this is going to be rolled out from the City of New York. So what I'll be talking about today is I'm going to go through the general overview of how Medicare Advantage works and how it compares to traditional Medicare and the senior care plan that's in place today. I'll spend quite a bit of time talking about the national provider access and what providers you can see under the Medicare Advantage Plus program. I'll go into the enhancements of the program, a high-level benefit comparison, and then I'll try to address some of the more frequently asked questions that have come up from retirees over the past month. So I'm going to try to proactively address many of the questions that I think many of the retirees may have top of mind. I just wanted to state that the program that the City of New York is offering is a customized Medicare Advantage program specific for the City of New York. So this is not your off-the-shelf individual Medicare Advantage plan that anyone can get on the open market. This is truly a customized group plan that is only available to the City of New York and their retirees. So this is a specific custom plan that was developed. It is a passive PPO program, which is a national program. So retirees across all 50 states and US territories are eligible to be enrolled in the plan. So this slide pretty much gives you an overview of how traditional Medicare and the senior care plan work compared to Medicare. A Medicare Advantage program basically combines all of the individual pieces that you have through traditional Medicare, which is your Medicare Part A hospital benefit, Part B medical benefit, and then the senior care coverage, and rolls it all into one program. So it is simplifying the experience for the member because you're having one identification card. You no longer have your Medicare card, your Empire Hospital card, and your Emblem Health or GHI medical card. You have all of those pieces rolled into one program. So it's one single identification card and it's one single explanation of benefits as well. So all of that is combined into one. Since we're contracted with the federal government to administer Medicare benefits, the Medicare Advantage Plus plan will cover everything that is covered under traditional Medicare today. So if it's a Medicare covered service, we're required through our contract with CMS to cover all Medicare covered services. We follow the same Medicare guidelines in regards to medical necessity. The process is a little bit different. With traditional Medicare, they may retrospectively look at a claim after the service was rendered to confirm medical necessity, whereas on the Medicare Advantage platform, we do much of that on the front end before the service is rendered, so that there's no surprises for members, and that there's no chance that a service was rendered and then later denied after the fact. So that's where the pre-authorization or the upfront review takes place. Now, in addition to everything that traditional Medicare covers and the senior care plan, there's also a whole host of additional enhancements that are now going to be offered under the program that Medicare and senior care do not cover today. Just to give you an idea, some of them are, hearing aid benefit, a fitness tracker, transportation benefit. There's also silver sneakers and a meal and a healthy pantry benefit. I will go into much more detail in regards to those enhancements on, I think, a slide or two later. But probably one of the most important questions that has come up from retirees is access to providers and doctors. Will I be able to continue to see the doctors that I'm seeing today? And members will have access to any Medicare participating provider. And there are approximately 850,000 providers nationally that participate with Medicare today. And out of those 850,000 providers, over 640,000 of them are actually in-network contracted providers with the plan. So these providers participate with Emblem Health or Empire or the National Blue Cross Blue Shield Association of providers. So retirees will have access to a very broad, huge in-network network of providers to access, but they're not bound to just in-network providers. Members will still be able to see an out-of-network provider that participates with Medicare and still have the same coverage and have the same co-payments for those services. So it's passive, so the cost share to the member is the same whether the provider is in-network or out-of-network. I did want to make a very important comment in regards to the network. Over 90% of the providers that retirees with the City of New York are using today are actually in-network contracted participating providers. So over 90% of those docs that members are seeing, they're all in the network already. I did want to call out two hospitals that have come up in the past in regards to questions from retirees. Can I still go to Memorial Sloan Kettering? And is hospitals for special surgery a hospital that I can access? Both of those facilities, while they do not have a in-network agreement with us, they have agreed to accept the New York City Medicare Advantage Plus plan. So they will accept the new Medicare Advantage program. And they actually currently see many of our Medicare Advantage members today that are covered under other groups. So both of those facilities will accept the plan. I did want to call out that this is a national program. So many of the other centers of excellence throughout the country, maybe Mayo Clinic or Johns Hopkins, all of those facilities also have been able to accept the plan and see members. So it is a national plan that members will have access to a broad number of providers. And one of the easiest ways that members can confirm if their doctors are in the Medicare Advantage network is they can either call the New York City Medicare Advantage Welcome Call Center number, which is 833-325-1190, or they can go online to empireblue.com and they can search as a guest. You do not have to be a member yet. So you can search as a guest. You will search as for a medical provider. You can put in your state. The type of plan is a Medicare plan. And then what's important is the network is the New York City Medicare Advantage Plus network. So that's the network that you would utilize to search for providers. What we're finding is sometimes when members are calling their provider's office directly, they may use a different name. They're using, this isn't the Alliance Medicare Advantage plan, or they're calling it the New York City Medicare Advantage Plus program. They're not using Emblem or Empire's name, and there seems to be a little bit of confusion in some of the providers' offices. So if you're in doubt, just call the call center and have them look that provider up for you. We are doing a provider education campaign. So every provider that has been utilized by City of New York retirees will have outreach to. So we are doing that with an email e-blast campaign, updates to the provider portal. We're also doing a mail campaign, telephonic outreach, as well as webinars. So our goal is to make sure that all of the in-network contracted providers receive the message that the City of New York plan is changing and that this is the new Medicare Advantage Plus program, so that they have a clear understanding. But we're also outreaching to those 9% of the out-of-network doctors that are not contracted with us to make sure that they understand how the program works and that they can simply bill us as the plan rather than Medicare, and we will pay those providers 100% of Medicare allowable rate. So providers are not going to be paid any less from the Medicare Advantage plan as they are receiving from traditional Medicare. Now, if there's an out-of-network provider that participates with Medicare, but they do not accept Medicare assignment, those doctors legally can charge 115% of the Medicare allowable rate, and the plan will cover that additional 15%. So for those providers that do not accept assignment, they are able to bill the plan the full 115%, and the plan will pay the full excess billing limit, and the member would simply be responsible for their applicable copayment. I touched upon earlier some of the enhancements that will be coming with the New York City Medicare Advantage Plus plan. The first one, which always seems to get a lot of attention, is Silver Sneakers. Silver Sneakers is the free gym membership that members will have access to. There's over 16,000 gyms that participate with Silver Sneakers nationally. Many of them are YMCAs, there's some LA Fitness, and there's some smaller local gyms that do participate. If you go onto silversneakers.com and you don't find your gym, you can always call our customer service line and let them know the name of the gym, and we will be more than happy to outreach to the Silver Sneakers partners to see if we can recruit that gym back into the program. Non-emergency transportation is included in the plan now. So Medicare does not cover non-emergency transportation. Retirees will have 24 trips, one-way trips to and from the doctor, pharmacy, or the hospital. You'll need to coordinate that 48 hours before you have your visit. And members can actually call our concierge health guide customer service team to help them coordinate that. So they will walk the retiree through the process and help them set up that transportation benefit for them. There's Live Health Online, which is the telemedicine program, and Live Health Online is an app that you can download to your smartphone, your computer, your tablet, and you can have a virtual doctor visit right over your smartphone with a physician. The Live Health Online visits are zero copay, so they are no cost to the member. Healthy Meals is now included in the program, and this was designed for post-discharge from the hospital or for members who have a elevated A1C or their body mass index is above or below a certain number. So members would qualify for the Healthy Meals based on clinical criteria. It's great for post-discharge because the last thing a member wants to worry about is cooking for themselves when they get discharged from the hospital. They will be eligible for up to 56 meals per year, and they are heat and serve meals that come to their home. So they'll come chilled and they just heat them up. 14 meals per event with a limit of 56 meals per year. The Healthy Pantry benefit is kind of similar, but it was designed for members with certain chronic conditions. I always used a diabetic or a cardiac patient as a good example for the Healthy Pantry benefit. This program is developed to help members with chronic conditions manage it better through dietary changes. So members who qualify for this benefit will have a pantry box, a shelf-stable pantry box delivered to their home each month, and it will vary month by month. And they will also have a telephonic nutritional counseling session with a dietitian monthly to help members stay on track. So the ultimate goal is to help members improve their management of the conditions through dietary changes. We also have the Wellness Rewards Program, which is another program that's in place to help incentivize members to do the healthy thing. So when they go for their annual physical, colonoscopy, mammography, all of their preventive screening services, they have the ability to earn rewards dollars in gift cards for all of those different various screenings and wellness activities that they do. There's also urgent and emergency care coverage worldwide. So traditional Medicare does not cover you outside of the United States or US territories. Under the Medicare Advantage Plus plan, you will have coverage worldwide for emergency or urgent care. The only thing the member would be responsible for would be their applicable copayment. So if they go to an emergency room while overseas, it would be the $50 copayment. If they go to an urgent care, it would be $15. And if they happen to be admitted into a hospital while they're outside of the country, they would pay their hospital copayment. There's also the health and fitness tracker. This is basically a Fitbit that members are eligible to receive. They're eligible every 2 years to get the Fitbit, and they'll also have access to the online programs that help support the fitness tracker. Routine foot care is included under the program for all members, regardless of their diagnosis, so you don't have to be a diabetic. This is open for all members, and it's 12 routine foot care visits per year. We also have Medicare Community Resource Support, and this was developed because there are many things that members might need that are not considered a medical benefit or a covered benefit under a plan, and that could be help with shopping or help around the house or building a wheelchair ramp or something that's non-benefit related, but there are community resources available right in your own backyard, and many of us don't even know where to go to access those services and resources. So we have a team in place that helps members find what community resources are available to them right in their own neighborhoods. Now, this is a high-level benefit comparison between the 2022 GHI Empire Senior Care Plan and the New York City Medicare Advantage Plus program. The plan itself for senior care is changing for January 1st of 2022. So I did want to point out that there will be a $15 copayment that will be for PCP and specialists under the senior care plan, and that's a change from this year. So currently today you don't have a copayment, but moving forward next year in January, that plan would have a copayment. Other than that, the benefits are fairly comparable. Both programs will have the $253 deductible annually. One thing I did want to call out is the annual maximum out of pocket, which is a little bit different. Under the Medicare Advantage Plus plan, there is an annual out of pocket maximum of $1,470. Under the senior care plan today, there is no maximum out of pocket. So the members' cost shares could continue to go on. There is no catastrophic cap. And for a retiree that does not have the 365-day hospital rider under senior care, there could be a potential for tens of thousands of dollars in out-of-pocket expenses on the hospital side alone. Now, the inpatient hospital benefit for both programs is the $300 copayment per admission with the annual cap of $750 per year. So if a retiree is admitted into the hospital 3 times, the most that they would pay in that annual period would be the $750 copayments for the hospital benefit. Skilled nursing care is covered for the full 100-day benefit period at a 0 copay per day. Under the PCP, The Medicare Advantage Plus plan has a 0 copayment. The senior care plan would have the 15. Specialty visits would be a $15 copayment under both the senior care or the Medicare Advantage Plus plan. The ER copay is $50 and dialysis is 0 copay under both programs. Now, the way this is going to work with the City of New York is they are going to be automatically enrolling every Medicare eligible retiree or dependent into the New York City Medicare Advantage Plus plan. So this will be an automatic enrollment, and you will be given an opportunity to opt out. So if you do not want to be in the Medicare Advantage Plus plan and you want to keep the current plan that you're on today, so if you're on senior care today and you want to keep that benefit, you have the ability to opt out during the month of September and October so that you will never be enrolled in the new plan. However, if you choose to opt out of the New York City Medicare Advantage Plus plan, which is the 0 premium plan for city retirees, and you want to keep your current plan, you'll have to buy up and pay the additional premium to keep that current plan. So for the senior care plan, the buy-up premium for the basic plan is approximately $191. And if you add in the 365-day hospital rider, which is $2.83, you're around $194 per member per month. And that would be the buy-up premium for the senior care plan. So retirees will have the opportunity to do that if they choose to. Will you have an opportunity to switch at a later time? If you wanted to switch into the Medicare Advantage plan or switch back, you'll be able to do that during the annual transfer period next year, or you would be able to utilize your one lifetime off-cycle change if you want to, if you haven't utilized that yet. Another thing I wanted to call out is the Medicare Part B reimbursement will continue under the program. So the City of New York will continue to reimburse members for the Part B premium as well as the IRMA, regardless of what program you're under. So if you're in the Medicare Advantage Plus plan or the senior care plan, or if you continue to stay on one of the other options and buy up to that premium, you'll be eligible as long as you are covered under one of the City of New York sponsored retiree medical plans. One of the other questions, let me just see, move back. Trying to think of some of the questions that have come up most frequently. One of them was, will I be paying multiple co-payments when I see multiple doctors in the same day? Members would be responsible for an office visit copay for every separate physician visit that they have. So if you go to your cardiologist in the morning, you would pay your $15 copayment. If you go for physical therapy in the afternoon, that would be a separate $15 copayment. But everything that the provider does within that visit is included in that single copayment that you pay. So, for example, if you have a whole host of tests done in one visit, that would be the single copayment that you would pay. When you're in the hospital and every time a provider comes in to see you, you're not paying a separate physician copayment when you're inpatient at the hospital or the skilled nursing facility. So that's included as part of your inpatient hospital copayment of $300. So you will not have separate copayments for every physician that sees you while you're inpatient. I did want to touch upon the pre-authorization aspect of the program. This has come up quite a bit on retiree meetings. The way the Medicare Advantage Plus plan works is in-network contracted providers are responsible for obtaining pre-certification for certain services. So that aspect is handled by the doctors. It is not a responsibility of the member at all. So the providers are the ones that work on this behind the scenes directly with the plan. And those providers know exactly what they need to do for pre-certification. Most services that require pre-certification are your planned surgeries and planned inpatient hospital stays, your complex diagnostics like your CAT scans, PET scans, MRIs. Those are the types of services that we're looking for pre-certification. And one of the reasons, as I mentioned, we do it on the front end so that there's no surprises. Medicare retrospectively will look at a claim, and there could be a circumstance where they may deny a claim after a service was rendered. So in-network providers are contracted and required to do this. Out-of-network providers are not obligated to pre-certify services, so they don't have to, but we encourage all providers in or out of network to pre-certify services so that the claims go through timely and that the provider gets paid. If they do not pre-certify, we'll pen the claim until we get the medical records. Once it's determined that medical necessity, all guidelines were met, then obviously the claim would be paid on. So, Cecilia, I don't know if there's any questions in the chat or anything. It's hard for me to see while I'm presenting.
Okay, yes, well, we have quite a few hands raised, and we have like 16 questions in the Q&A so far. So
I just opened it up, so let me read through them.
All right.
Okay. What if you are under 65 on Medicare? This program is for all Medicare eligible City of New York retirees. So this is also for members that are under 65 that are on Medicare due to disability. So it's for all Medicare eligible members. Next question. If you opt out of the Medicare Advantage plan, what other plans are available to you? If you choose to opt out of the Medicare Advantage Plus plan, you can opt out to stay in the current plan that you're in today. So if you're currently on the GHI Empire Senior Care Plan, you can opt out to stay on that plan if you want to. If you're currently on the Aetna Medicare Advantage plan and you want to stay with Aetna, you can opt out to stay with Aetna. But I did want to point out that if you opt out to stay on your current plan, there will be a premium that you will have to pay to stay on that plan. And it will be the premium difference between the Medicare Advantage Plus premium, which is the base plan, and that plan is $7.50. So anything above $7.50 will be the retiree's responsibility to pay. So for example, the senior care buy-up premium is roughly $194 per member per month. We do not know what the Aetna or some of the other plan buy-up premiums will be. That will be posted on the OLR site, and that will be posted during your opt-out period so that you'll be able to make an informed decision as to what your costs would be. In a Medicare Advantage PPO, the Medicare can see any Medicare provider, even if they're out of network. However, out-of-network providers are not required to see PPO members. What will happen is all Medicare participating providers are eligible to be covered under the program. And typically what happens is if a provider says that they will not accept the program, we're advising members to contact the concierge call center so that we can do outreach to that provider. Typically, it really comes down to simple education that the provider needs to know that there is in and out of network benefits and that the Medicare reimbursement for out of network is the same as what they're receiving today. So we try to advocate for the member, and we will contact that provider directly to make sure that there is a continuity of care and that you'll have continued access to that doctor. We're hoping that the provider education campaign that we're doing proactively helps to alleviate much of this on the front end so that we're doing outreach to these doctors today. Okay, the question is, why would you search for in-network providers if you can see any Medicare accepting provider? This is really just peace of mind for some members who want to be able to know that their doctors are definitely in the network, but you don't have to do that because you will have access to any Medicare participating provider. So you're not bound to the network. It's really just for member peace of mind. They just want to confirm. If you have a college-age child still covered under Emblem Blue Cross Blue Shield, what will happen is if you have a under a non-Medicare eligible dependent covered under your program, that non-Medicare dependent will stay on the current commercial plan that they're on today. So for example, if you're on the GHI senior care plan and your underage dependent is on the GHI Empire CBP plan, that will remain intact. So your underage dependent will stay on the current plan that they're on today. In regards to prior authorizations, the turnaround time really depends on what you're having done and the urgency of it. So if it's an urgent situation, typically pre-approvals or the prior authorizations are done within 24 to 48 hours. But if it's something that is not an urgent situation where you're scheduling down the road, let's say you're having planned surgery done, in a couple of weeks, it's usually done within 7 to 10 days. But obviously it's based on our urgencies. Emergent and urgent prior auths are done immediately. And if it's an emergency situation where you're admitted into the hospital emergency, then all rules are thrown out. We don't have to worry about prior approval in an emergency situation. Okay, I addressed the one over, one under plan and how that works. If you have Medicare Part A from the city and reimbursed to get Part B, I have Emblem as my secondary. I get RX and dental for the union. Okay, so for those retirees that receive benefits through their union, that will continue. So if you currently get your prescription drug benefits through your union and you get your dental or maybe vision or hearing, that will continue. The union benefits are not impacted by this. The only thing that's impacted is the medical portion of the plan, and that is replacing the senior care, GHI senior care plan. Can you opt out of the Medicare Advantage plan afterwards? How long do you have to stay in the plan? So if you if you go into the New York City Medicare Advantage Plus plan for January 1st of next year and you did not opt out, you will have the ability to opt out and go back to your old plan. You can do that at any time if you haven't utilized your once in a lifetime plan change. Otherwise, you can wait until the next transfer period, which would be next fall, to go back into the other plan. Are there co-pays for multiple skin biopsies at a dermatologist visit? No, you will pay one specialist co-payment visit for that dermatology visit. So if the dermatologist does 3 or 4 biopsies on that one visit, it's just the single $15 co-payment for that specialty visit. If the retirement, so for anyone, if the question is about retirement age 57, well, you'll be eligible for the plan at age 57. The program that I'm reviewing is for Medicare eligible retirees only. So if you're 57 and you're not on Medicare yet, you would go on to the early retiree plan, which would be the GHI Empire CBP plan. And then once you become Medicare eligible, then you would be switched over to the New York City Medicare Advantage Plus plan. If you decide to keep the current senior care, the GHI senior care PPO, with the rider, the buy-up cost to keep the senior care plan is $191.57 for the basic plan and $2.83 for the 365-day hospital rider. So the total cost would be the $194.33. If you're referring to the pharmacy, the Emblem Health Part D rider, that program will still be available to retirees that do not receive their drug coverage through their union. And I believe that cost is about $130 for the RX rider for those retirees eligible for that. Coverage for diabetic supplies and medications. For those diabetic supplies and meds that fall under the Medicare Part B as in boy benefit, are covered under the program at a zero copayment. For those diabetic medications that would fall under the pharmacy benefit, you would pay whatever your applicable copayment would be under your current pharmacy plan. But for Part B as in boy and supplies, it would be a zero copayment. Okay, some of these are duplicates. We're talking about the pre-certification timing, the buy-up. So the question again is confirming the buy-up costs. So if you have a retiree and a spouse, each are covered under the senior care plan today. In order to keep the senior care plan, the buy-up premium would be the $194 per person. So in this case, it would be, close to the $400 per month in additional premium to buy up to keep the plan. If you opt out and go to a different health plan on your own with traditional Medicare, so for example, if a member is requesting if I want to go out and purchase an AARP supplement, are you still going to get the Medicare Part B reimbursement? The answer would be no. You have to be covered under a City of New York sponsored plan in order to be eligible for the Medicare Part B reimbursement. So if you drop your New York City coverage, you would not be eligible for that Part B reimbursement. A question came in, are there any deductibles that need to be met? There is an annual deductible under the program of $253, and that's for any medical service. So it's whether it's professional or hospital, it's just the one single annual deductible of $253. There are no additional separate deductibles that need to be met under the Medicare Advantage Plus plan. It's just that one singular annual deductible. Question from Joy, I'm turning 65 October. And you have to decide on care. If you move, okay, so what will happen is you will choose a plan that you want to be enrolled in from October through the end of December. And then for January 1st, that's when you would be enrolled into the Medicare Advantage Plus program. So you're becoming Medicare eligible in October, and the timing of this actually kind of overlap. So you will potentially get different communication pieces from the city and from us in regards to how the timing of the program changes will work. The plan is national, so you can be in any of the 50 states in the United States or US territories. So this program is portable. It covers you anywhere in the country as well as US territories. So if you live in the Virgin Islands or you live in Puerto Rico, this program will cover you there as well. The optical and dental benefits, those are covered through the union. So whatever benefits you get through the union, under the Medicare Advantage Plus plan, there is no vision or dental benefits included. More questions about relocating to another state. Can I take my coverage with me? This is a great question. I should have addressed it earlier. Margot asked, can I select and go to a specialist directly? Or do you have to go through your primary doctor to get a referral? There are no referrals required under this plan, so you can go to your specialist directly. You do not need to get a referral from your PCP. How do I opt out and when will I get information on how and when to do this? The City of New York is mailing an initial notice of change letter announcing this change, and that is going out the end of August. So retirees should be receiving that within the next 2 weeks, give or take a day or two. Immediately following that, retirees will receive their their full pre-enrollment guide. It's a booklet, and it outlines everything about the Medicare Advantage Plus program in great detail. It also includes instructions on how to opt out. So there will be an opt-out form that's included in the pre-enrollment kit that you can send back in. There's also instructions where you can opt out online through the microsite. And members, depending on what plan you're enrolled in today, you will have a designated opt-out time frame. So for senior care members, you'll have the ability to opt out from September 1st through October 1st. So all of those instructions will be included in the pre-enrollment guide that you receive. And on the opt-out form, they'll be clearly stated what your additional premium will be. So you need to sign the attestation that you understand if you're opting out to keep your current plan, that plan will be a cost of X, and that will be coming out of your pension. Question in regards to Memorial Sloan Kettering. MSK is a contracted hospital on the commercial side. We're actually working on ratifying a Medicare Advantage contract with MSK, but they do see Medicare Advantage members with us today, and we reimburse them the Medicare allowable rate for those services. So in regards to accessing care and covering members, there is no, there's continuity of care there. Members will still be able to access them. International coverage for emergencies, I touched upon this. You have worldwide coverage for urgent and emergency care. If you go to an emergency room, it would be the $15 copayment. Urgent care would be $15, and then in inpatient hospital admission, you would have that $300 copayment. The maximum, someone's asking, can you please explain the out-of-pocket maximum? The $1,470 is the maximum out-of-pocket expense that a retiree will pay on an annual basis. So that will include the $253 deductible that you pay up front. It will include every $15 copayment that you pay at specialists. It will include your ER copays. It will include your hospital admission copays. So if a member meets their deductible and goes into the hospital 3 times per year and sees, 10 doctors per month, there's a chance that they would hit that maximum out of pocket. But this is your catastrophic cap, so that once you reach that, you will not have to pay a copay for any additional services. That would all be covered 100%. Okay, I reviewed through the costs. Okay, Donna asked, please clarify copays. Give an example. MD visits $15 copay, then a physical therapy visits $15 copay on the same day. If the provider accepts assignment and is not a specialist, is there a copay? The way this would work is if you see a PCP, so this is a primary care physician, that would be your general practitioner or internist. Those providers have a 0 copayment. So all other specialists would have the $15 copayment. If it's an out-of-network provider and that provider participates with Medicare but does not accept Medicare assignment in full, we would cover the additional 15% that the provider can bill us, and the member's cost share will still be just that $15 copayment if it's a specialist, or a 0 copay if it's a primary care physician. The question is, you referring to the old plan, are there going to be no other plan options other than the Medicare Advantage plan and the plan that you're currently in? What will happen is during this transfer period, the only options a retiree will have is to the Medicare Advantage Plus plan or to remain in the current plan that they're enrolled in today. So retirees will not have an opportunity. The city is not allowing them to switch to a different plan. So if you were on senior care today and you don't want to be in the Medicare Advantage Plus plan, but you wanted to switch to, say, the Aetna plan, the city is not allowing changes between plans. What they're allowing is the Medicare Advantage Plus plan, or you can opt out to stay in the current plan that you're enrolled in today. For outpatient services, so if you have outpatient services done, outpatient surgery is covered. There is no copayment for that. But if you have an outpatient specialist visit done, for example, if you have something done, your colonoscopy, you would pay your $15 copayment for that to the provider. Our mammography is free. Your annual screening mammographies are zero copay. So all services that are deemed preventive wellness screenings are covered at a zero copayment. So you would pay no copayment for that screening mammography. Question is there coverage for prosthetics? Durable medical equipment and prosthetics are covered under the program, and they are covered under the program at a zero copayment. Okay, I think a lot of repeats here. Just want to make sure.
Yeah, I think there are a couple of repeats, but we also have a number of participants with their hands raised. So if we can have a couple of questions
Sure.
from those with their hands raised. Thanks, Kim. Juliet, you can go ahead and unmute yourself and speak. Juliet, you're still muted. All right, let's go to Doreen. Doreen Gatanas. We can go to Doreen and then we'll come back to Juliet. Doreen, you can unmute yourself.
Yes, my question was answered. Thank you.
You're welcome. All right. Juliet, was your question answered? Joy? Joy Benjamin, you can unmute yourself. Guys, star 6 to mute and unmute yourselves if you're on your phone. If you're on a tablet or a computer, simply click on the microphone tab in your lower left-hand corner and unmute yourself. Juliet, you muted and unmuted yourself. You're muted again. All right, Isosa. Go ahead and unmute yourself and ask your question. All right, let's come to Tia. We'll come back to anyone who didn't get the opportunity to ask the question. Tia?
Yes, how are you?
I'm great. Go ahead, please.
My question is more directed towards NYSNA.
Mm-hmm.
Last month, I received an email 3 hours prior to the meeting about this new change. And there were only 300 people on that Zoom meeting. Now, I don't know how many NYSNA members are on this meeting because it doesn't show.
Mm-hmm.
But I received a phone call yesterday, a rapid phone call, because I could barely get the information down. It was a recorded message stating that we were going to have this meeting today. Mind you, this call was made after hours, so any appointments that I had today had to be changed the day of. Why are we so late getting information about meetings that are so important as this? And how many members are presently on this Zoom meeting? Because many of my members have called me saying they got a phone call, but they didn't get an email. And then I have other members who were like, I didn't even get a phone call.
All right, Tia, first thing, emails, please note that emails, this information was sent out via e-blast to all active and retired NYCNH mayorals as well as CUNY members.
I beg to differ with that. I beg to
All
differ with that. I really, which is why I'm mistrusting this whole changeover of our health plans. I worked for the city of New York because I knew I was going to have great benefits. I was practically guaranteed this. And now, just turning 65, it gets pulled from me.
So tell me, what are your concerns regarding what is being changed?
My concerns is that this was done in the dark because none of the members that I know of knew this was even going down. So it's something that's done in the dark, you know, doesn't appeal to me very well.
All right, Tia, let me give
a lot of distrust.
I can understand how you feel, but please note that this was not done by any one individual union.
I know.
Right.
I know.
So, and it wasn't done overnight. There's been ongoing discussion. I know we had prior
3
meetings.
years.
I'm sorry?
3 years. I found that after the fact, but members were not aware. I was not aware.
Right.
No one that I speak to, even other city workers from other agencies, don't even know what I am talking about.
Well, there may be some who don't know, but there's also a large number of persons who know. And I'm sorry that you were not aware, but this is not the first meeting we've had. I've asked Kim to come on to specifically for NYSNA. She's been holding meetings, you know, throughout with all of the unions. And I asked for us to have an individual forum.
How many members on this meeting right now? How many people are on this Zoom meeting?
They're over 280, but I don't think the number matters. The information is being sent out.
No, it's not. No, it's not.
Can I ask that if this is Judith? Hi, how are you? I'm so sorry that you have not got the emails. I'm asking everyone.
No, I did get the email. I got the phone call and I received an email.
Right, so
I've been getting phone calls from other members saying.
Yeah, here's how.
Right, so I think that
let me ask you to follow up with me because we have like 10 more people with their hands raised. I can give you my personal number. You can call me. That number, you're ready? Tell me when you're ready.
I'm ready.
You ready? All right, that's 917-275-4752. You have it?
Yes, thank you.
Right. You're welcome. You can call me after and I will be happy to, hear your concerns and address them accordingly. But I just need to have the opportunity to let the others who have their hands raised thing. And you can call me after, okay?
I shall.
Thank you. Thank you.
You're very welcome. All right, bye-bye. Doreen, we heard from Lucille. You can go ahead.
Hi, how are you? I'm Lucille.
I am great. How are you doing?
Good, good. I just wanted to verify the statement about opting out. I want to opt out totally from senior care from the city as well as, and keep my traditional Medicare.
All right, hold on. Let Kim answer. Kim?
I think she had a second part. Did you finish your question? I think she had a second part to the question.
Oh, sorry.
Okay, I wanted to know, if I opt out of the new Medicare Advantage plan and keep my existing, and also opt out of my existing senior care plan to keep the traditional Medicare care plan and purchase my own Medicare policy. Is that permissible? I was a little bit unclear before when you were speaking about it. And also the fact that on the last Zoom meeting, we were told that we would still, because there's a city law, that we would still be getting our Part B reimbursement, whether we stayed in or opted out. So I'm confused about that.
All right.
If you choose to opt out of the city plan altogether, you can do that. But it's my understanding that the city rule is, in order to be eligible for the Part B reimbursement from the city of New York, you have to be covered under a city of New York retiree plan. So I would confirm that with the OLR, but the understanding is If you opt out, if you drop your coverage altogether, you would not be eligible for that Part B reimbursement.
Another question is, you can never get through to the OLR if the phone rings once and goes to busy signal. So I've tried multiple times.
What I'm going to do is, we actually have a call. We have our weekly summary call with the City of New York tomorrow at noon. They are updating, they're in the process of updating their FAQ document that's posted to the OLR site. I'm going to ask them to put that specific question and the response on the FAQ. And once I get confirmation, I will email that to Cecilia as well so that I can give you a definitive answer.
Okay, great, because it's very frustrating when you keep trying a number and you just can't get through to somebody.
I'll get a firm answer for you.
Thank you so much. I appreciate that.
Okay, and Lucille, you can email me so that I can follow up with you with the response when Kim sends it to me, okay?
Thank you so much. I appreciate it.
You're very welcome.
You.
Let me see who we have now. Joy? Joy, are you able to unmute yourself? All right, I think it's Bethel. You can unmute yourself.
Hello?
Hello, you're on, Bethel. Go ahead.
Okay, I'm just confused because I've not had these meetings before. This is the first meeting.
Mm-hmm.
I'm 75 years old. I retired in 2006.
Mm-hmm.
And sometimes I don't understand, and I've been trying to keep myself healthy, so I haven't been going to doctors and so forth. All I do is I keep up on my yearly maintenance. I go to my doctor to see if I'm doing well, any problems. I go to the my GYN and so forth, and my dentist and so forth. I keep in my eyes. But recently, I started to have a problem. I just came in today I joined this late because I came in like 2:39 or so in the house to get on this. I just came from having a sonogram done on my right breast because my GYN had ordered a mammogram. I did that. They saw something suspicious, so they scheduled me for this sonogram. So I just had it done. But what is happening is that when the last time when I went to my doctor, and I had a problem with my left wrist following carpal tunnel surgery in both hands. That was the cause for me to retire early because that happened. And where I worked in the ICU, I needed to use both my hands. And the doctor says I can't lift more than 15 pounds. Now, when I got bills coming. Now, my doctor ordered I was supposed to have
Bethel, sorry, I don't mean to interrupt you, but I don't want you to share too much of your personal health information because
I'm just saying
people on the line. Mm-hmm.
Okay, but what I am concerned about is the fact that when I don't expect it, bills coming to me.
Okay.
Because this person didn't pay, the thing. They said I wasn't covered, or it wasn't they didn't think it was necessary. Now, I had to have surgery in my hand. Mm-hmm. And my doctor did my blood work and everything, and referred me to this doctor for the surgery. When that was done, the lab sent to me, I had to pay $884 to the lab for the result because what it called Empire or one of them did not think that lab work was necessary.
You know what, Bethel? Here's what I'll do. Just one moment. Since this is something that's occurred from current and not pertaining to this plan, how about you reach out to me, offline regarding this because this is occurring now, and let us see how we can look into address that concern. Do you have any questions pertaining to the new Medicare Advantage Plus plan in the meantime?
Yes. So this card that I have that says Medicare Health Insurance,
mm-hmm.
Part A, Part B. This is going to be changed.
All right, Kim.
Yeah, the new Medicare Advantage Plus program is going to replace your Medicare card, your GHI card, and your Empire card. So we will be covering all of those services rolled into one. So when you see a doctor, the only card that you would be showing them would be the Medicare Advantage Plus identification card that will cover you for doctors and hospitals.
Okay, so because I have these 3 cards here, I have the Empire, Blue Cross Blue Shield, I have the Emblem Health, GHI Senior Care, and then I have the Medicare. And when I give them, they would take, I usually give all of them because I don't know what they would take or what they need. And I've had my doctors for years, for, 10 whatever years and so.
Yeah, you would just show the one.
But then I have a problem. For 2 years, I have a broken denture, and because of the...
So here's the thing. Here, let me give you my number. And you call me so that I can help you address those ongoing concerns. Tell me when you're ready.
Yeah, I'm ready.
All right, that's 917.
Yeah.
275. 4752. My name is Cecilia, last name Jordan.
Jordan. Okay.
Yes. All right. So we can help to sort out this ongoing issue that's present. All right.
Okay. Thank you so much.
You're so very welcome. Thank you.
You're welcome. Have a good day.
You too.
Okay, bye-bye.
All right. Who's next? We have Linda. Linda, can you unmute yourself, please? Linda? All right, let's go to Gwanda White-Jones. Gwanda? Gwanda, you can unmute yourself. Okay, let me see. We have quite a number of hands. Then next is phone number 953-098. 953-098.
Hello?
Hello, who's speaking?
Hello. This is Linda Guevara.
Oh, hi, Linda. Go ahead.
I'm sorry. I was trying. I have a new
That's
iPad.
okay. I understand.
Having a problem. Okay. I live in New Jersey. Can I still see my the doctors I'm seeing here?
Yes, the program is national, so you can access the providers in New Jersey under the program. The New Jersey providers might be participating in the Horizon Blue Cross Blue Shield network, which is the Blue Cross Blue Shield brand in New Jersey. So those would be the in-network providers, but you can see any Medicare participating provider. They don't have to be in the network.
So they don't have to. How would I know that they are anybody? I can see anybody?
You can see any Medicare participating provider, but if you want to confirm if your doctors you're seeing today are in network, just for peace of mind, you can call the call center number, which is the 833-325.
I'm sorry, 83?
833-325. 1190.
1190.
Just give them the names of the doctors and they'll look them up for you and confirm if they're in the network. The good news is 90% of the doctors that retirees with the city are seeing are in-network providers. So there's a very good chance, very highly likely that they're in the network.
So with this new the Medicare Advantage, I can, even if we're not here, like we go to the Philippines and you get sick in the Philippines, you can make use of that?
Yes, you'll be provided worldwide coverage for urgent and emergency care. So if you're in the Philippines and you have an urgent or emergency situation, those services would be covered.
Oh, okay. Thank you so much.
You're very welcome.
This is Judith Kim. Could you put the number in the chat?
Sure.
Oh, thank you.
All right. Scott, unmute yourself, please.
Yes, good afternoon.
Good afternoon.
2 basic questions. It would appear when I reviewed on the Anthem website, most of my doctors are listed as in-network. In speaking with my GP and my cardiologist, they didn't know they were signed up for this program. So my first question is, why are they signing up physicians without asking them first?
We would not be able to sign up a physician without their authorization. So they actually have a contract. So they may not realize that they have this contract that encompasses all of the programs. This would fall under all of the Medicare Advantage programs that Empire and Emblem Health have. So it could very well be that they weren't familiar based on the naming convention, but we can't just arbitrarily sign doctors up. They would have to sign an agreement.
They would have to go on par with the network, correct?
Well, if they're in network, they have a signed contract with us, and it could just very well be that he didn't realize that he did. But we can't sign them up without the doctor's authorization.
So you're from Empire.
Yes.
I was a little late coming in. You represent the group Emblem and Empire, correct?
Yes, I'm with Empire Blue Cross Blue Shield, and I am the account executive that will be managing the group Medicare Advantage product that the city is offering.
Okay. My second question would not be relevant to you, but I do understand that some people are considering legal action as to the method that the MLC voted on this contract. Basically, there is no listing of union or local count who voted how. I know that the New York State Nurses Association asked for a review period and they were denied, as was several other groups. So my question...
Since that question won't be, Kim would want the person to answer that, I can provide you with information that NYSNA has regarding that, and that is something that we can follow up with within the union, but that wouldn't be a question that Kim would be able to answer.
I understand that totally. This is not her area. But is the association considering
that is something
how
we
this
will
was done?
let us talk about that at another unionized meeting and allow the other members to have the questions, answered. And that's something you can always follow up with me and Judith after on, okay?
Thank you very much.
You're very welcome. All right. Next, after Scott, who are we? Kathy? No, Julia Savinka? Is that Julia?
I think Julia was having trouble unmuting and she
Can you hear me?
Oh,
yes.
Okay, Julia.
Yes, thank you so much. So please expand on the acupuncture, physical therapy, chiropractors, and all these therapies. Thank you so much.
I didn't hear your question. Can you repeat it again, Julia, please?
Yes, sure. Can you hear me now?
Yes, that's much better.
Wonderful.
Yes.
Yes. So I'm interested in some kind of expansion on acupuncture, chiropractor, and physical therapies. So how this is covered?
For physical therapy, chiropractor, those services would fall under specialty care. So those visits would be a $15 copayment that you would pay for each of those visits. For the chiropractic care, it would be limited to the Medicare covered benefit for chiropractic care. So for all services that Medicare covers today, it would be covered under the plan and it would be the $15 copayment.
Thank you.
You're welcome.
But I don't know how to mute myself back, so if you can help me.
If you're on your phone, just press *6. If you're on your computer or tablet, simply click on the microphone tab and a red / would come across to show that you're muted. Okay, I'll mute you. I'll try to mute you from here. You are muted again, so that's good. All right, who's next in line? Sorry if I'm jumping over. I'm just going to go through. Vanessa Brown. Vanessa? Just unmute yourself, please, to speak.
Hello?
Hello, go ahead.
Yes, I think my question was answered before. The lady who had the problem getting information from NYSNA.
Right.
I am one of these people too, because I got a phone call which was very rushed, and then it said I would get a follow-up email, which I didn't get. So I had to call NYSNA to get more information. And when I tried to explain my situation, it was not a very comfortable conversation. But anyway, in the previous call, I did get email, I got text, I got a call. And so the person I spoke with thought that I was not in the database, which I am sure I'm in the database. So I'm one of those people who had a problem too, but I did get an email eventually from NYSNA. So that is settled.
All right. Thanks, Vanessa. I'm sorry you had a, unpleasant conversation with whoever you reached at NYSNA. I'm sorry about that. Why some persons may have not been receiving, say, hustles or e-blasts. I even recently, when I'm sending out hustles, a lot of people choose the opt-out button. Once you press opt-out, guys, you will never receive any more emails or anything from us when you opt out. Opt out means that you do not want to receive anything else. So if you want to ignore a particular message, please do so. But if you opt out, that happens. Sometimes persons may move or update their email addresses and don't give us. Please feel free to write me and give me any changes to your email, and I'll be happy to have them updated in the system. Okay?
Okay.
All right. Next, Kathy, Lauren, Kathy, did I call on Kathy? Kathy Giordano?
Hi.
Hello.
Hi. I have a question.
Sure.
I came in a little late on this on the Zoom, but from what I gathered is if we kept the 2022 senior care, that's going to be $194 a month.
Correct.
Yes.
Okay, and then that would mean I would also probably want to keep the Medicare Part B, which is like $148.50 a month.
Correct.
The Medicare we will get back like we usually do. But then the $194 we won't. Am I correct?
Correct. Correct.
Okay. When are we going to get all this information in the mail and to decide whether we want to opt out or not?
The first week of September, roughly.
Okay.
So the first thing you'll receive is a letter from the city that's going to be announcing this change, and then following that, you'll receive the full pre-enrollment guide that goes into a lot more detail. So everyone should be receiving it early September to mid-September is when you should be looking for it.
And all the information you covered today will be in that?
Much more information will be included in that, yeah. So what I went over today is really a high-level snapshot of things. The enrollment guide will have a lot more detail for you.
Okay, thank you.
Okay, thank you. All right.
There's a question in the chat, I'm sorry, about.
All right, go ahead.
How, that's from Mr. Briggs, how the deductions from the pension will impact each plan. I'm not sure if you can answer that, Kim.
Well, what will happen is the cost of the plan will come directly out of the retiree's pension. So if they choose to opt out and stay on senior care, their pension will be reduced by the $194.33 per member. Now, if a retiree doesn't have a pension large enough to cover the cost of the buy-up premium, they would be billed for the premium difference.
All right, thanks, Alberto. Someone Zoom user? You can unmute yourself. Mr. Briggs, did that fully answer your question? Alberto, you're asking how to unmute. If you're on your
Could you hear me?
Oh, yes, Mr. Briggs. Let me just answer.
Yeah, what I want to know, what about the question is really and truly has to do with retiree. And the important thing for retiree is that most of them have worked their life and they're on fixed income. They're on fixed income. So therefore, what I would like strongly, I think the concern of all the retirees is the fact that would this plan really impact how much money they will be allotted each month in terms of their medical conditions. And it seems to me as if it was, I don't want to believe, but I'm kind of wanting to slight with the rest of the people who make complaints that it's kind of slighted in the fact that the city is trying to, I would say rob. I like to be very transparent. Rob the retirees of their retirement. And if this plan continues to escalate, because maybe it's a pilot program. I know it's a new program, but how could they contain the costs for these retirees if it gets out of hand? That is the question. That is the key question that has to be answered.
All right, let me let Kim answer, Mr. Briggs.
Thank you.
You're welcome.
The city was looking to evaluate their retiree medical programs that they offer. The city and the unions were in a position where they needed to find alternative ways to be able to save revenue, save premium for the city, while also maintaining a rich level of benefits for their retirees. So they wanted to have a Medicare Advantage program that was developed to very closely mirror the benefits that are covered under senior care today, so that from a coverage and a member experience standpoint, it's still offering retirees a rich level of benefits, but at the same time, it's giving the city the ability to save significant premium dollars. So the city's in a position with the changeover to the new Medicare Advantage Plus plan, which is not really a pilot program. Empire and Emblem have offered Medicare Advantage programs for a number of years. So we have a significant number of current Medicare Advantage group members. This particular plan was customized for the city. So yes, this is a custom plan for the city of New York, but they're looking to save $600 million by making this move. But they also didn't want to force this on retirees and eliminate choice. So that's why they're giving the retirees the ability to opt out if they choose to. So you do have the choice, but the new Medicare Advantage Plus plan will be the baseline zero premium cost plan for retirees.
Okay, I know we are running. Mr. Briggs, I hope that answers your question. Justin, because of this time, I know Kim is up around 4. Let me just get to the others quickly, make sure we don't have a repeat question on, don't miss any ones. So Millicent Simpson. Millicent? All right, BJ?
I'm here. Millicent Simpson is here.
Oh, go ahead, Millicent.
Yes, good afternoon. I'm presently living in South Carolina, and I under GHI, Emblem, and all that. I can't find a physician in South Carolina that covers any of this. My question is, my Medicare that I pay for and my United Health Care, which is my Plan B, will that be affected? I know that I'll automatically, my GHI, CBP will automatically roll over to Advantage. But will it affect my Medicare, which is not through NYSers?
The Medicare would be administered under the new Medicare Advantage Plus program. So the new plan would be your Medicare and secondary rolled into one. So it would impact that. So you're saying that you have Medicare and you're purchasing a separate United Healthcare plan on your own? And
yes.
Okay.
Yeah. Yes.
So what will happen is this will impact that because your Medicare would now be covered under the Medicare Advantage Plus program. So what you would want, if they're a Medicare participating provider in South Carolina, they would be able to accept this plan and simply bill us for the benefits. If you wanted to keep your Medicare and United, you would probably have to drop your New York City coverage.
Oh, okay. All right, thank you.
Thanks, Alison. All right, Alberto, I skipped over you. You're up next. So, and just so that everyone will know, if you don't have a chance to speak now, because I know it's 4 p.m., 4:02, please email your questions to me, and I will absolutely ensure that you get an answer. So, Alberto, go ahead, please.
Hi, good afternoon. My question is, if I'm in Europe and I have to go to the emergency room or get admitted in a hospital, and they ask me to pay for the bill, what do I do? Do I have to pay the bill and then when I return to the US, apply for reimbursement? How will it work, the international coverage of the new plan?
Because Blue Cross Blue Shield is a global brand, in many countries, providers recognize the brand, and on your identification card, there's information for the provider, for the hospital to call in regards to submitting claims. So most of the time, depending on the country that you're traveling to, they'll be able to bill us directly. But if it turns out that you are going to pay for the service up front, when you get back, you would submit the claim in for reimbursement.
Okay. Thank you.
You're welcome.
You're welcome. All right, I'm going to turn over to our President Judith to close us out. Ladies and gentlemen, let me just thank you all. I know that, there's not enough time for all the questions you have, but I assure you, please email me. I can put my email address for those of you who don't have it and my number in the chat. And I absolutely guarantee you that I'll get you answers. So Judith?
Right, okay, so thanks again, everyone, for being on this call. Thanks for the impact that you have laid us with, and us that's still working. We are grateful that you have been our mentors. I'm going to ask Kim, thank you, Ms. Parker, and your team so much for this wonderful presentation. I've been getting a bunch of text messages to thank you, and I thank you myself. So if NYSNA members need to have a follow-up meeting with NYSNA, please be sure to send the email to Dr. Jordan. She'll reach out to me, and we can put together something as always. So thank you again, and I'm going to say good night to each and every one of you, and stay safe.
Thank you, Judith. Thank you, Cecilia. I appreciate it. And if it's additional meeting is needed,
thank you.
Reach out, and we'll be more than happy to coordinate another follow-up if you feel.
Oh, that would be great. Absolutely. Thank you so very much. Thank you. All right, all. Bye-bye, guys.
All right. Thank you.